Hello and welcome to the Trusted Podcast. I am your host, Blake Johnson. Today we're going to be talking about allergies, and I've got my good friend, Dr. David Reeder, who is an allergy specialist, and he's going to be giving us all the information. So, Dave, thanks for joining us today.
Hey, absolutely. It's great to be here.
All right, Dave, just give us a little bit of background about yourself and your office and what makes you guys the trusted experts in your field.
My name is Dr. Dave Reeder. I was born and raised in Mesa, Arizona, went to school for undergrad at BYU and graduated in exercise science. For those of you that don't know, BYU is Brigham Young University. I went to medical school at the University of Arizona College of Medicine in Phoenix. I completed residency in Mount Auburn Hospital in Cambridge, Massachusetts, and I finished fellowship actually just this summer in Irvine, California. And I'm out practicing in the real world now. It feels great. I just joined a practice called Arizona Allergy Associates, and we have 5 locations. One is in Central Phoenix, and all the other ones are in the East Valley of Phoenix. Um,
Gotcha.
yeah, that's briefly about me.
I think Dave's being, a little humble there. When he means he was in Massachusetts, he was doing his residency under Harvard. So, definitely don't want him to pass that over.
It was one of the Harvard teaching hospitals, but it wasn't like their flagship. It wasn't Brigham and Women's Hospital. But yeah, it was a really fun time in Massachusetts, a chance for my wife and I to have an adventure. And we loved all the places we've trained at, all the people we've been with.
Yeah, so needless to say, you've done a lot of school and a
It's
lot
so
of
true.
hands-on learning in different hospitals. So I think you definitely have the credentials there. So let's dive right in. What are the most common forms of allergies that you see, and talk about whether they're preventable or curable.
So, when you talk about allergies, what you're really talking about is a situation where your body is mounting an immune response against something that otherwise isn't inherently dangerous. So, when you take allergies that affect the nose as an example, something like birch pollen isn't inherently dangerous in and of itself, but your body, for some reason, targets some portions of birch pollen protein and somehow convinces itself that it's dangerous, and it decides to mount an immune response against it. It creates inflammation, and then all of the symptoms of that inflammation become known to the patient. So when we're talking about just the nose, you see things like a stuffy nose, runny nose down the lip, that's called rhinorrhea, runny nose down the back of the throat, that's called postnasal drip. That postnasal drip can cause sore and scratchy throat, frequent throat clearing. I hear patients sneeze all the time. So there's a host of changes that start to happen in the nose, and then because of the dripping aspect of the nose, also in the throat. That same kind of process, if the birch pollen comes into contact with the eyes, can cause eye symptoms. So watery eyes, itchy eyes, red eyes. And if it's inhaled into the lungs, it can actually precipitate something like an asthma flare, asthma attack, asthma itself. And so you'll have patients complaining about shortness of breath, wheezing, cough, chest tightness. Um, as an allergist, I help manage all these things. But interestingly, there's also non allergic triggers for all of these things too. So I know for me, I've had those symptoms in the nose my entire life. And it's not just allergies that's causing them. When I walk by strong perfumes or colognes, it triggers my nose as well. Strong deodorants can do it. Cleaning supplies, and I tell my wife all the time, oh, I can't clean that. It's going to trigger my nose symptoms. It doesn't usually work, but sometimes if it's especially bad, she lets me off the hook. Um, let's see. We take care of other stuff. We take care of eczema. That's a dry, itchy rash on the skin. We take care of hives. We take care of, let's see, we can tinker with the immune system if there's immune deficiency. So I'm not just an allergist, I'm also an immunologist. If someone's having recurrent or severe infections, we can actually help to replace part of the immune system that's non functional in certain circumstances. Um, there are very limited roles for this, but sometimes we can actually change someone's genes. It's called gene therapy or gene editing, and we can replace for them what their body isn't making itself. So there's some really slick therapies that are kind of hot off the press. Some of them are still being developed, and it's really fun to be part of this field because I'm making a difference in patients' lives, helping them breathe better. It's fun to be a doctor.
So let's talk about, there's obviously treatments and different things that you can do. So if with these treatments, is it more of just managing symptoms, or can they eventually become to where they stop having that allergic reaction to the birch pollen or whatever it is?
Yeah, that's a great question. Um, so we have several different approaches to helping patients that complain of these symptoms. And sometimes it is caused by allergies, sometimes it's caused by the non-allergic triggers. As it pertains to the allergies and the non-allergic triggers, we can always suggest therapies that are intended to alleviate symptoms. And so we can give you therapies that will stop the nose from being so darn stuffy, and it can dry the nose out. And we can prevent a phenomena with the allergy-specific inflammation called priming, where less and less of the allergen is required for your body to mount an immune response. Um, there are immune modulating therapies, and that's a complicated word. What it means is that I can actually change some aspect of the disease itself rather than cover up the symptoms with a band-aid. And those immune modulating therapies come from something like allergy shots. Um, so with the allergy shots, we actually intend on introducing you to very small amounts of the substance you are allergic to. And over time, we build up that threshold, that dose for you, and we get you to a point where your body is becoming so accustomed to seeing this allergen that it effectively raises its own triggering threshold for how much you need to be exposed to in order for your body to mount a particular immune response. But also, we're changing the immune responses that your body makes. We're changing it from a particular antibody called IgE to different types of antibodies like IgG1 and IgG4. We can get really into the minutia, Blake. I don't think your
Yeah, I don't think
audience
we need to
is.
go that far into
Yeah.
it.
Um, but yeah, essentially, we can change the way that your body responds to allergens in a way that effectively takes away that allergic response at normal exposures to allergens. So, in 85% of patients, they report that their symptoms are either blunted or, in some cases, taken away by allergy shots. And that helps with the nose, the eyes, it helps with the breathing. Um, we have a recent indication even for eczema, particularly with house dust mite, which is a really interesting allergen. So that was a great
Right.
question.
So what about, if I'm at home and I constantly expose myself to whatever I feel is making me allergic, am I going to have the same type of response as the allergy shot by giving the exposure that way, or is there something else with the allergy shot, like, or is there anything I can do at home to help, expand my range there?
Um, at home, really the only studied therapies for how to effectively induce those kind of immune modulating therapies, it's allergy shots. Um, in Europe, they do a little more with sublingual therapy, sublingual meaning under the tongue.
Hmm.
And they've put a lot of stock into trying that as a alternative. But here in the States, we prefer the allergy shots because they do tend to be more effective as we've studied them. And so the literature tends to be on the side of the states when it comes to that particular argument. I'm sure if you ask a doctor in Europe, they'd say that the studies we've done on their sublingual therapy, their under the tongue therapy, were not entirely fair. But that's a debate among allergists, I suppose. Um, in the US, there are actually 4 different under the tongue FDA approved therapies. I don't find myself reaching for them often, but I suppose if you're started in a doctor's office, there's no reason you couldn't continue that therapy at home. And so when you're talking about being exposed to, let's take a few grasses as an example. If you're allergic to only one or a handful of grasses, theoretically you could have the same kind of beneficial response with those FDA approved particular allergens. If you take that under the tongue therapy as opposed to going into an allergist's office and getting those shots. But in general, the answer to that question is no. It's really something you need to see a specialist for,
Okay.
and see them for it on a regular basis.
What are the biggest mistakes you see people make when they get allergies?
I guess it talks about. It depends on what type of allergy we're referring to. I think the biggest mistakes I've seen actually pertain to food allergies, and I'll tell you why. It's not uncommon for allergists to get referrals from primary care physicians, pediatricians, family physicians, internal medicine docs, and the common complaint is my doctor just told me that I have food allergy. Um, and as the story goes, the patient's been complaining of some type of like gastrointestinal problems, bloating, maybe some bowel changes, and they ask their physician to order like food allergy testing. And the physician orders the food allergy testing. A few things come back as high, and then they're told to keep those things out of the diet for time immemorial. And in some cases, they're asked to see us at or around the same time. The problem with that it involves a few different issues. Now, if they're children, especially, you run into a few problems. If you're telling a child that they have something like cow's milk allergy and they actually don't, um, you're really taking out a wealth of nutrient dense foods that should sustain the child and help the child grow. And so you're limiting their options for a nutrient dense food. The other problem is that if a child has an antibody made against a particular food, and that's really what the test is measuring, then the child can develop food allergy that is a clinically significant food allergy. So we're getting a little in the weeds again, but what the test, the blood test or the skin test that we do is actually looking for is an antibody against something. It's called sensitization. Now, when you talk about food allergy, it's not really diagnosed by a test, it's diagnosed by a patient. And so the best test I have for food allergy is you, Blake. So if you drink cow's milk or eat butter that's made from cow's milk or ice cream or yogurt or cheese, any one of a number of things, if you have something like a life-threatening reaction every time you have cow's milk-based products, that's the best test I have, your history. Um, if you get a little bit of bloating and you get some bowel habit changes when you have, let's say, a milkshake at Denny's or wherever you like to get milkshakes, that isn't the classic kind of food allergy that's the life threatening kind, the kind that is assisted by antibodies. That could be something more like lactose intolerance. Um, the only blood test we have that's a reliable blood test is the kind that tests for the life-threatening kind of food allergies. Um, and I'm making some generalizations here just to keep it simple. But so we have these parents coming in asking for a wide net to be cast, and then they pull back all these foods and they see what comes back. And so a few different things pop up, and the story often goes that the child was drinking cow's milk on a very regular basis, not having any reactions, and then they stopped having the cow's milk for 6 months to a year. If they stopped that nutrient dense food, again, the problem is that they were missing out on those crucial nutrients. But another problem is that they could have developed food allergy because they weren't eating or drinking cow's milk based products. And then that raises a whole host of different questions that I have. And we end up having to retest them and potentially challenge them in the office with something like a swallow challenge to cow's milk product. So um, that's one of the problems I see people encountering. And these are problems that are in part coming from other physicians. So it's a problem in communication. It's a problem in misunderstanding what the test results mean. Um, and I wish that weren't the case, but I'm happy to get involved when those patients come because I can really help.
Yeah, and I know we've talked extensively about peanut allergies and how we've seen a spike in that over the last 10 to 15 years. Do you want to speak to that at all, and what you think is the result of that?
Yeah, so I love peanut allergy. It's a really fascinating topic. Um, So the recommendations from the medical community used to be that you should avoid peanut products until the age of like 2 or 3. And a few years back, some allergist colleagues in England were talking to their allergist colleagues in Israel, and they said, "Hey, like, what do you guys think about this peanut problem? What's going on?" And the allergists in Israel were like, "What are you talking about? There is no peanut problem." And come to find out, in Israel, there's something like a peanut Cheeto that kids are exposed to at a very young age. And they're gnawing on these peanut Cheetos all the time. They're enjoying the peanut Cheetos. And the incidence of peanut allergy, that means how often it affects a population in a certain amount of time, it was just drastically lower than that in England. And so they designed a study. Um, and this study was looking at early introduction of peanut versus late introduction of peanut, and if that was associated with the development of peanut allergy. They did the study, it was called the LEAP trial, and then they did a subsequent study called the LEAP ON trial. And you can look this up, it's really fascinating stuff, but what they found was that early introduction of peanut actually is protective against the development of peanut allergy. Um, and there are particular groups that are at risk for developing peanut allergy. Those that have eczema and those that have egg allergy are among those at risk populations. So, peanut allergy prevalence was definitely increasing, in part because of the advice that the medical community was giving. It was just bad advice. And so, we've since reversed our instructions. We've asked patients and families to start introducing peanut at an earlier age. And we hope that that will change the trends. Food allergy in general is increasing nationwide. And we don't exactly know why that's the case. We have several thoughts or ideas. Um, but one of the reasons why peanut allergy in particular was increasing is because we were giving bum advice. So I'm glad that we've changed that. We've done the studies. It's convincing results. And so that's a change that you've probably seen.
Yeah, I remember when we first had our son. He's 8 now. It was, yeah, don't expose him to peanuts or anything like that. And um, we did it accidentally at like 7 or 8 months or whatever, and he had a small reaction, but that was it. And then the next time we exposed him to him, didn't have a reaction, and that was our experience. So it was like, oh yeah, it's going to shock their system because it's something new, but the body learns how to handle that. And I think, I mean, I have no basis or medical authority for this at all, but I think in general our allergies are increasing just from the same standpoint of we're inside more, we're not exposed to nature, we're not out in those elements, and so our bodies just are not used to handling them all.
Yeah. Um, there's something called the hygiene hypothesis in the allergy world. And it basically says the same thing. We've observed that patients who come from third world countries or environments, they don't really have problems with allergic disease. Um, and something of the same results have actually come from more rural areas of the United States and other developed countries. If you're exposed to microbes from things like, it's kind of gross, but pet feces or a lot of different like farm products, your chance or risk of developing allergies is less than that of the developed urban world. Um, it's again just a hypothesis, and it's probably one of the reasons for why the incidence and prevalence of allergic disease is increasing. But I think there's really good weight behind it. It makes sense.
All right, so when for sure does someone need to seek out a specialist like yourself with an allergy?
Okay.
Is it just when they start barely starting having symptoms, or how far down the road should they be?
Um, I think there are disease-specific instructions for when that ought to happen. You can take a kid who's wheezing, for example. Every child who wheezes doesn't need to see an allergist within the week. But if a child is wheezing to the extent that they're being brought to an urgent care center or an emergency department on, gosh, anything resembling a regular basis, I think that's when a primary care physician ought to say, you know what, I'm not doing you a service by continuing to try to manage this on my own. Let's get someone else involved who can be part of our team so that we can manage this better together. Um, there's nothing inherently dangerous about allergies affecting the nose, but it does affect things like, let's say, workplace productivity. We developed a validated inventory that looked at workplace productivity and found that those who have allergies affecting the nose are 28 to 40% less effective when they're symptomatic with those nose symptoms. And so, would you like to be more effective at work? If that's the case, and you're not getting the kind of relief that you want from over-the-counter therapies, come see an allergist. If you have eczema that is really poorly controlled, if it's keeping you or your child up at night because the itch is so bad you just can't help but scratch it, come see an allergist. It's uh, it's it's hard to come up with hard and fast principles for when someone needs to come see an allergist, but if you feel like it's a problem, that's always an indication in and of itself. But especially if it's a problem that will get worse and potentially be life threatening, like food allergy or asthma, you should definitely come in and be seen. And the interesting thing about eczema too, Blake, eczema predisposes to the development of allergies in the nose and eyes, and also predisposes to asthma. Um, an interesting thing that I wasn't anticipating on talking about is that in a way you can help to change not just your own allergy profile, but if you get something like allergy shots, you can actually change the risk of your children developing allergies and asthma. Um, we've done a few studies on that, and the literature looks to be more towards the convincing side that it's helpful in that regard. Your kids will have a lower chance of developing those kind of problems if you go through that disease modifying therapy. Interesting
So
stuff.
that it all comes back to modifying the genes, and obviously those genes get passed on to your kids. So yeah, it makes sense that would help.
Well, I don't really know if you're changing the genes, but there is something called epigenetics where you're changing gene expression, and that may be where the magic is happening there.
Okay. Fascinating stuff. All right, we're running out of time. So, how can someone find a good allergist if they think they need to see? What are the key things they should be looking for with an allergist? What are the red flags they should stay away from?
Sure, sure. So, there are plenty of practices that will tout their capacity to manage allergies. Many of them are board certified or board eligible allergists, and I'm trying not to step on colleagues' toes. Some practices are not. Some practices are run by specialists that come from other disciplines. Um, so I always hold hard and fast to the traditional approach, which is that I only want to practice stuff that's really in the scope of my practice. So as an allergist, I manage allergies. If you're going to a doctor who didn't specialize in the management of allergies and wasn't trained, I'm not sure that I would I'm not sure that I would really choose them as a allergist. So you don't want to see a joint specialist and be treated for allergies because they weren't trained on how to manage allergies, and you may not receive the standard therapy if you go there, and so you're running a risk. So what you're looking for is a
Like
board certified or board eligible allergist.
yeah, it's like the same thing with the practice of law. Like you have family law specialists, you have criminal law specialists. Those don't overlap. They definitely don't overlap with estate planning, which is why I don't do any of those litigation areas or anything like that because this is my field, this is what I'm comfortable with, and I know that, and I do all my continuing education, and it's the same thing with you. You learn and you focus, and you know how to deal with allergies. You're
Yeah,
not a heart surgeon.
true. And nor would I want to be. I see some people trying to practice within my scope of practice, and they're not trained on how to do it. And sometimes I find myself correcting their mistakes. And I would never pretend to be a heart surgeon. I would be doing patients a disservice if I opened up their chest and started to look around, because I wouldn't know what I'm doing, Blake. So I think finding a board eligible or board certified allergist is really the way to go.
Okay. Any red flags other than that? Then they just look at their credentials. I mean, well, let's say, is there a place where they can look to verify their credentials?
Sure. There are different certifying institutions that have running lists of uh, certified or eligible practitioners of allergy immunology. I think one of them is you can look up a website. I think it's Quad AI, AAAAI, and there's like a find an allergist search bar that you could enter.
Okay. I like it. All right. Well, thanks, Dave. Anything else particular with to allergies that we missed that we definitely need to cover?
I don't think so. Yeah, I speak for the practice in general, but we love what we do. I hope you can see that when you come and try and get help from an allergist. Most of us have allergies ourselves, and so we know where you're coming from. And that's why we ended up in this field. We're passionate about helping to manage symptoms and helping to manage the disease itself. Hopefully, we can take the edge off of the symptoms or get rid of them.
Awesome. Well, how can people get in touch with you at your office if they're in Arizona and want to come see you?
Yeah, you can come by. We've got actually a really small wait time. Part of it's the time of year right now, but part of it is also coronavirus. You can call any one of our referral centers, and I don't know the number off the top of my head, but if you just search up Arizona Allergy Associates, give us a call, and I'd be surprised if you couldn't be seen within the week. In some cases, you'll need a referral from your primary care physician. It depends on your insurance. In some cases, you can just show up and we'll take care of you.
Perfect. Well, thanks, Dave. I appreciate you being on the show and explaining so much and not putting it too far over my head.
Blake, it's always a pleasure.
Yeah, and to our listeners, thanks for joining us today. As always, please like and subscribe to get the latest content for the Trusted Podcast. And also reach out. Let me know what guests we should have on here next time. And with that, we'll sign it off for now. So thank you, Dave. We'll talk to listeners next time.